So the next slide, as we can see, is about the revenue model. What is the revenue model for XPRT2ND, right? So we can see the majority is going to be one-time user fees, right? So we know once the patient uploads their imaging, once they upload their subjective, once like the MRI, X-ray, and then they put a little subjective in there or any other notes that they may have from their previous provider. At that point, once it gets uploaded, they have a choice of what they want to pick. If they just want to just one second opinion, if they want a specialist, if they want the concierge level treatment, whatever it is, that's the one-time user fee, right? So it's a flat fee that they're going to basically pay, and that's the majority of the platform. Obviously, there will be provider sponsorships that'll be on there, from imaging centers to big insurance companies or malpractice insurers. It might be any of that that'll be there as provider sponsorships. We also will have, we were debating about provider sign-up fees, and that's only once we get to the point of we have hit our 500 user model, right? So once we approve the MVP, we will be looking at provider sign-up fees at that point in time, which might be a couple of years down the road. But it's one of those things that we're looking at and we're debating on if we even do that for the providers or we just bring on providers and have them based on their level of expertise. All right, so here's the patient life cycle, and I slowly touched base on this throughout my conversation with you today. The patient comes in. Usually, the patient is at physical therapy, right? They're already in physical therapy, and the physical therapist is the one that will refer them to the platform. That's how we are looking at the physical therapist will be the one that shares the link. The patient comes to the platform, and that's when they pay for the platform, right? They're paying for that service, and that's when the orthopedic evaluation will take place, right? So the ortho is giving multiple orthopedic surgeons will be giving their second opinion, where the patient will have the opportunity to look at one or multiple second opinions. Obviously, this is the conversion stage. They either convert and come back to that orthopedic surgeon from the platform to do a procedure where it's a higher level case that the orthopedic surgeon gets, or they come back in conservative care, which they come back to the original physical therapist that referred them into the first place, right? So all in all, it's a nice cycle that we've developed that goes. It's a great feedback loop that between the physical therapist, expert second, and the orthopedic surgeon and the patient, obviously, which we get the best result. Here are some results from our national consumer survey. So you can see from the age range that we are looking at that we see the optimal range will be between 40 to 77. And even between that, we've narrowed it down now between 55 to 60. We know that that population will travel for their procedure. So that's even more intricate surveying that we've done. We know that the most common price range, someone would pay is between 100 to 300, but we've now looked at it. So for an orthopedic surgeon, we know that between 250 to 300 is what we are leaning more towards to charge on the platform. Obviously, that higher level of care, that 500 patients, there are patients that'll pay up to 500. And there are some that'll pay up to 1,000 for that concierge level of care. So these are things that will all take testing, and through our beta phase, we'll know which patients will do it. We know that there's going to be a percentage of patients that will travel, right? And we found out that patients that will travel will be up to 27% that will travel. So very interesting information we got from our consumer survey.